A 32-year-old female patient who is in her post-pregnancy has occasional urinary incontinence while working out in gym. According to the Oxford Manual Muscle Testing Scales, her strength is 2, which would be the best position to exercise and decrease incontinence. Option A, supine lying with 1:4 contractions. Option B, side lying with 2:4 contractions. Option C, sitting with 4:20 contractions. Option D, standing with 5:25 contractions. The correct answer is C, sitting with 4:20 contractions. Option A, supine lying best for pelvic floor strengthening. Option B, side lying would help a weak pelvic floor muscle strengthen. And option C, correct answer is sitting, as sphincter muscle are best strengthened in seated position as its gravity assisted position. Option D, standing would be in further progression, not initially.